Welcome everybody to the webinar. We're going to get started in just a few minutes while we wait for everybody to log on and be ready. I'll just give it one more minute. Looks like most people are on. Okay, we're going to go ahead and get started. Welcome everybody to our webinar, Expanding Rural Care, a Telehealth Roadmap. And today it's presented by AMD Global Telemedicine and Solutions. And we'd like to get started first by introducing ourselves. Kristen, can you, the next?
Yes, thanks, Carrie. This is Kristen DeProspero. Just remember the Kristen part, with Solutions, VP of Grant and Adoption Services.
Hello, everyone. My name is Paul Mitnick. I'm with Solutions also. I manage the Great Lakes region out of Ohio and spend a majority of my time on telemedicine and distance learning projects.
And I'm Amy Miller, the Regional Director of Growth East. I handle the Eastern Territory of the United States, and I would be happy to assist you folks in the East with finding the best technology for your virtual care goals.
Great, thank you. And I'm Carrie Souza. I'm the VP Marketing here at AMD Global Telemedicine, and I'm going to be moderating the webinar today and getting everybody to hopefully ask their questions. We'll have a time at the end of the webinar for you to submit your questions, but feel free to type them in along the way, and we will address as many as we can. And if not, we will provide you with email addresses for all of us at the end if you have any follow-up questions. Okay, so first, just to kind of kick off, we have a question for, I'm going to launch this right now. It's, how familiar are you with the grant application process for virtual care?
It's a good question.
So go ahead and put in your answer. This will, for one, help us gauge, of course, you know, how much information you need on that process versus other areas. We have a presentation prepared, but we have everybody on here is very well educated with that process. So we'd like to kind of guide that based on the answers. Okay, let's see. Okay, so sharing the results, everybody should see them here. Only 3% are very familiar and have been through the process, 34% somewhat familiar, and 63% not familiar at all. So yay, that's why you're on this webinar today.
That's good. Yeah. Okay, good. Well, I'm going to go ahead and get started if that's okay, Carrie. There's a lot to go over. So let me start with just a review of what we're going to talk about. And there's some of this that I'm going to be able to go into detail, and some I'm just going to kind of have to gloss over, but hopefully we'll make it as important and as detailed as you need it to be. But essentially, we're going to be talking about how do you find, apply, and win and comply with grants. And one thing I want to say about grants in general is that you're basically making a contract, an agreement with the grantor, whether that's state, federal, local funding, whomever it is, you're agreeing to accept their support, but you have to do it in the way that they ask. So that's important, and I'm going to cover some topics around that. So I'm also going to give you the top 10 tips to increase your grant readiness. I'm going to cover some key funding sources. I'm going to drill down, dive deeper into a specific funding source from the USDA. Then we're going to talk about winning examples of projects that have been funded. We'll cover telehealth, telemedicine technologies, elements of a grant proposal and timelines and what your next steps should be. So before I talk about anything else, I want to set the foundation and talk about the types of funding. We're going to focus pretty much on the first one, the competitive and discretionary grants. This is exactly how it sounds. You have to compete for the funding. And this could be at any level of grantor, meaning state, local, federal, even private foundations. They can offer competitive. And then there's formula funds, capital grants, and others. But I'm going to kind of stick in the arena of competitive grants. So the top 10 tips to increase your grant readiness. We did a webinar on this a few months back, and I really can't impress upon you enough how important these tips are. I really could probably talk for 2 hours on this, but I'm not going to do that because we have a lot to cover. The first thing that is most important you see has the green box around it, and that's about knowing your logins and your credentials to the various grant application websites, specifically grants.gov and sam.gov for federal grants. What's important is that you know who is the authorized organizational representative and what is their login, and are they available when you need to submit the application. So it's really important that you track that down because there's turnover. There's all sorts of issues that come into play. The last thing you want to do is take weeks, if not months, to prepare a grant and not be ready to submit it because you don't have the logins. And we're going to do a poll about this. Right, Carrie?
Yes.
Okay, let's do that.
So do you know your login credentials for grant.gov and or sam.gov?
And this is obviously a reinforcer to encourage you to make sure that you know that or know how to get it.
Or when you get off the seminar, go and find out.
Exactly.
Good point.
Exactly.
Okay, I'm going to end the poll. Looks like most people have answered. And about 70% do not know their login.
Okay.
30% do. So what now?
Well, within the first couple of minutes, we've already learned what's really important, and that is go figure that out. Find out what your logins are. Most of the organizations that are on this call probably have pursued grants in the past. If you haven't and you need to sign up for these logins, you need to go ahead and do that immediately because it can take weeks, if not months, to get those logins registered. So that's just the first tip. I'm also going to talk about knowing your goals and your 5 W's, but first, which is on the right-hand side, first I'm going to drop down to the box that says, know what you need for a grant. I'm going to pass it to Paul to talk about that for just a minute.
Yeah, so all of these grants that we're reviewing today are to help you get funding, to accomplish certain tasks. And one of the largest ones that's coming up from the USDA is a capital grant that also includes all the services. So you have to have a good vision of what you need to accomplish your task. So if you're trying to reach out to rural communities and you need to, increase connectivity to your partners, all of this has to fit into your narrative. And you have to end up creating some type of budget, right, to be part of your application. And that's where this team that you're talking to today can help you. But everything has to fit together. Your goals have to fit together with your funding request, and your partners have to fit in with that narrative. And so part of what we help everyone do is make everything fit together. So when you're turning in the application, the people who are reading the application can visualize exactly what you need.
Absolutely, it's important. And in order to get to what you need for the grant, you kind of got to know What I refer to is the 5 W's, the who, what, when, where, and why of your project. What I've put on this slide are a couple of things that are related to telehealth, the application, the use case, if you will. So primary care consultations, addiction and prevention and treatment for behavioral health, school-based health. These are just a few samples, but the why is what's most important. So those 5 W's, the who, what, when, where, and why. The why is on the right-hand side. Are you trying to reduce barriers to access? Are you trying to reduce cost of service and so on? I'm not going to get into the details, but this is what you want to be thinking about when you're figuring out what your budget is and why you're trying to accomplish it and what you need, because all of that is going to be important to clarify in the grant. So a tip, though, is that we offer a free service. This is why we're doing this webinar today. It's to help you increase or identify your readiness and increase your readiness. Let's go through all of these things that you need to look at to prepare yourself to apply. So we at Solutions offer this as a free service. There's no cost or obligation, and we help you search for funding sources. We help you build your team, and we help you submit your application. We don't do any grant writing. Let me repeat that. We do not provide any grant writing support. That's something you're either going to have to leverage internally, or we can refer you to grant writers, expert and seasoned grant writers. So let's look at where you go to find funding sources. There's a lot of places. There's hundreds, if not thousands of places. You're going to want to look, at grants.gov is important. I didn't list that one here, but since you're going to have to sign up and get your login, know that you can research and search for funding sources at grants.gov. But also, since we talked about this grant being a focus on rural areas, I had to list RHI Hub first. The ruralhealthinfo.org site is fantastic. It's a really, really good place to look for funding. You can also sort by type, topic, sponsoring agency, and state, so you can drill down. You can also look at HHS, HRSA. You can look at the TRCs, the various telehealth resource centers across the country. There's 12 regional and 2 national centers that have funding sources listed. We're also going to spend some time talking about the USDA funding source that is 30 years old this year. Its anniversary it started in 1994, so it's now 30 years old, and that's a grant we're going to dig into. And also the FCC is a good place to look. We're going to get this presentation to you as well. Also, you need to look at your state-specific resources. I listed a couple here. We have Texas and we have Ohio, because I know we have a couple of people on here from both states. There is a plethora of funding sources that will be listed. You remember earlier I talked about formula funds, and these are sometimes considered pass-through. They can flow from the federal level down to the state level, and then they're dispersed in all of these other different types of grants. So you're all going to have state-specific websites you can look at to pursue these different funding sources. Okay, and we can help you find out what those are when you connect with us. Okay, so the key funding sources we're going to drill into are the RUS grant. We talked about that. The industry, the business of this grant, we've all kind of come to call it the RUS grant, but it's from the Rural Utility Services Division of the USDA, and it's the Distance Learning and Telemedicine grant that I'll dig into next. You also have the BHI grant, the Behavioral Health Integration Grant, that's due this year, March 22nd. and will award up to $350,000 per awardee. And the program links are in here as well, so you can click on those and learn more about who's eligible, what the focus is of the grant, and if there's a match. So you see that column that shows the match. Sure, it's nice to have grants that don't have a match. Those are hard to come by, really, really hard to come by. If we can find them, we'll help you, but these are just two that don't have a match. So let's jump into the distance-oriented telemedicine grant. We don't yet know what the application due date is going to be, but we do have our ear to the ground. What we understand is that the announcement or the opening of this grant should be happening probably next month. And then it's going to be due in 60 days. So as soon as that hits the street via the Federal Register, which is that little page in the middle, it's just a sample, there's then 60 days to apply. That's not a long time. There's a lot to do. In fact, Paul, you've been helping customers prepare for this for practically a year.
That might be a little drastic, but the real point is this grant is going to open, this application window is going to open sometime in March, we believe. We were talking to the USDA earlier. And then, as Kristen said, you have 60 days to apply to it. It's a great grant. It covers all the hardware, excuse me, installation, maintenance for the 3 years, training and adoption for 3 years. The USDA has really thought it through. It's a great grant. But after the seminar, if you have interest, if you are rural and or your partners are rural, either or both, then it's a great grant. So, after this seminar, it'll be worth, looking into this, contacting us, and getting prepared to apply for it. So the timing of this seminar is very good. We thought this grant was actually going to open sooner, but it's been pushed into March. So you're really in good shape to pursue this if it fits the needs that you've identified for this year.
Yeah, so let me talk about the basics. You kind of mentioned some of it, Paul. Who's eligible? Well, basically everybody except individuals. For-profit, nonprofit, .gov, .org, .edu, all of those types of organizations are eligible. The key is that you have to either need to or already be providing services in the way of two-way interactive communication to rural communities. And we mean very rural. We'll get into that next. You can get up to $1 million from this grant. You can request 500,000. You can request more or less, 1 million. Let me just say, this is a detailed grant. It does take a lot of effort on the front end to apply. I don't want to scare anyone away. We know how to do it. We've been doing it for 30 years, but it's no small task to apply for this. It's going to take some commitment. I say that because I suggest that you apply for as much as you can get instead of a low amount. Really think big. Go for the most you can that can support your project.
Yeah,
There is a, go ahead,
that
Paul.
being said, Kristen, it is a 3-year grant. So you should really think big and not what I can roll out today, but what I can roll out in 3 years to my community. So as Kristen said, the minimum you can ask for is $50,000, but most of our partners we work with end up asking much closer to $1 million because you don't get extra credit points for asking for less. So you might as well have a full vision,
That's true.
a vision for the 3 years, and ask for what they're willing to give you for this grant.
Yeah, and I usually tell people at this point, I try not to be too scary about how hard it is to apply on the front end. What's beautiful is that after you win, the post-award process is pretty simple. Your burden is much, much lower. So put the work in now. And I mean that as compared to other funding sources that require all kinds of reporting and lots of detail and tracking. This is not that kind of grant. This one's going to require very little on the back end, but they do check in, want to know that you're doing what you tried to accomplish with the grant. So there is a 15% match. That means that you have to contribute up to 150,000. If you request the million, it's $150,000 match, 15%. Therefore, if you request 500,000, it's a $75,000 match. But the whole point is to deliver, excuse me, is to deliver telemedicine and or distance learning services to rural areas. And you're going to want to have partnerships. It kind of puts the distance and the tele into distance learning and telemedicine, having other locations to connect to. But to have those partnerships, you really got to have your MOUs or your agreements by the time you submit your application. You don't want to wait for those relationships or just sort of propose that relationship. You're going to have those partnerships at least agreed upon. They don't have to be fully fleshed out, but you do have to have them agreed upon. So rurality is key. When the USDA says rural, they mean really rural. 5,000 or fewer in the population is preferred. 10,000 or fewer is okay. You just get fewer points. And as you increase in the population, you get even fewer points. You have to be at least 20,000 or fewer, but I can tell you, you're not going to be competitive. You're probably not going to win if all of your locations have 20,000 or fewer in the population. It's just too competitive of a grant. So just keep that in mind. It is based on physical street addresses and locations that are going to benefit from the grant. And so we help them, don't we, Paul? If you give us your addresses, we'll do a pre-score.
Right. Yeah. So it's actually very simple when you think about it. If you think about your rural partners, you actually take their street addresses, and if they're in a town of 5,000 or less, they get the full 40 points. If it's 10,000 or less, they get 30. So if a majority of your partners and or yourself are in these type of towns and cities of these sizes, then you're getting the maximum number of points. Our team under Kristen's direction can help score your vision. And sometimes we start working with an organization and they have lots of partners, and we look and see, and sometimes you can't roll it out to everyone because maybe there's a couple of partners of yours that are in, major cities. So you say, okay, well, we're not going to service them under this grant. We're going to service everyone else who has the high score. So we can help with those conversations as well as the scoring to put you in a good position to win the grant.
Absolutely. Okay, so what does this money pay for? This is directly pulled from the grant guidance. So if you look in the middle of the page, computer hardware and software, interactive audio and video equipment, computer networking components, telecommunications terminal equipment, data terminal. I'm saying it because it's important. Inside wiring and cybersecurity to cover the related products in the project. Let me show it to you in a different way. If you think about the distance learning and telemedicine, live, interactive, two-way communication, that telehealth technology that we're talking about today, put that in the middle. And then everything else that you need around it would be eligible expenses. All of that equipment in the middle, plus the surrounding tools or services, like inside wiring. This is the cabling you need to get to every room in the clinic to be able to connect to the internet via from the telemedicine cart or the installed telemedicine system. Also, network gear that terminates the circuits from the telecommunications provider, cybersecurity to protect all of that. The shipping, installation, 3 years of maintenance and support, and technical assistance or training is all covered, including taxes if you're a for-profit organization. So keep that in mind when you're thinking about the budget, and we do a lot of work to help you flesh out that budget, to get creative, think about what you can use to implement your project, and we let you know what's eligible and what isn't in that budget. Okay, so your physical locations. The way that they're categorized are going to be hub only, hub end user, or end user sites. So if you look at the one on the right, the lower right, the hub and spoke model, that site A might be in an urban city. That's okay, as long as they're delivering services out to rural places. That's really important because everyone thinks, oh, this is only for rural organizations or rural places, but it's okay if the hub is in an urban location. Next, we're just going to show you some images. These are some past winners. These are different projects that we worked on. In the upper left, you see that it's a little picture, but it's a telemedicine clinic. It's a little, I think that one's a school-based health clinic. What I'm going to do now is pass it over to Amy, and I'm going to show, actually, I think what we're going to do first is have a quick poll, and then we're going to go to Amy. So let's do that poll, Carrie.
Great. So just to kind of gauge where everybody is, if they're familiar with virtual care, if they've ever had programs before Amy talks about some of the technology. Have you been involved in implementing a virtual care or telehealth program in the past? Okay, interestingly enough, 63% have and 37% have not.
Interesting.
So it's my role, guys, in the Eastern Territory to help you find the best technology for your use cases. So oftentimes I'll set the stage in conversation of what type of care will you be providing? How many locations will you have? Are you doing facility-based telemedicine where the patient is going to come into a community health center, a clinic, and maybe you're needing to connect remote providers? So we can talk through all those things. The point here is don't get overwhelmed by the technology. There's lots of options out there, but we'll help you find what makes the most sense for the type of care you're wanting to provide. Just a little bit about AMD. Obviously, we're a technology company, but we do have a proprietary platform called Agnes Connect. It does allow you to stream medical devices while you're doing a video conference. So it's doing it all in real time. And the great thing about that is we have medical devices that will stream and allow a remote provider to make a diagnosis based on what the medical images are and the medical sounds. So it's a different type of care compared to just a video conference where you're just relying on the patient to tell you about their sickness. You're actually able to see medical data. We also integrate with EMR platforms, and we have point of care stations. So if you have a situation where maybe you don't have a lot of space, we'll find you a solution for that. If you're wanting to do something mobile, we'll find a point of care station for that. So we have lots of flexibility. So just happy to provide any type of information you might need. If you're needing to do a budgetary pricing proposal for these type of grants, I'd be happy and my team would be happy to put together the information so you know exactly what the cost would be for hardware and software.
Can I
Thanks, Amy.
say something about that topic, Amy?
Sure.
It's interesting that some of our grant applicants start in a certain manner and then they grow the program. So oftentimes we'll put in, you'll see a cart in the middle here with no diagnostic equipment. And oftentimes in year one, we're putting carts, into the partner sites to do behavioral health, fully knowing that these diagnostic tools are available. And oftentimes the program builds on itself. So you go from behavioral health to physical health. There's dental tools. I mean, you can keep building on this platform. What the Agnes software provides that's very relevant is, HIPAA compliant communication, live communication between the practitioner and the patient, as well as Amy said, back-end reporting. And so it is a very strong platform. But my message, and the reason I interrupted, is you could start at a certain place and continue to grow your services to your community as you have your resources in place.
Yeah, we have seen that so many times, and I think everything on this slide we've seen implemented. Something else I want to point out too that just occurred to me is that the two-way interactive video conferencing piece of this puzzle, AMD Agnes and AMD products, the hardware and software, are agnostic. It's kind of funny, agnostic, because any platform, whether you're already working with, say, Microsoft Teams or Zoom, this platform we're on today, or some other type of platform, that's okay. We're not talking about changing or replacing or moving that out. This is really for the consultation, for the true application of the telehealth effort, providing that telehealth consult and capturing the content and data and records and information necessary for the healthcare experience. So don't worry that you're somehow changing platforms or something's not going to work together. It's agnostic and works with those platforms. Okay, now we're going to give you a way to sign up and request a free consultation. So we can go into these types of things in greater detail. But for this DLT, this RUS, Distance Learning and Telemedicine Grant, this is just a brief insight into how they do the scoring. And remember, I said virality is key. So if you have those exceptionally rural locations, each location gets scored, and those that are 5,000 or fewer are going to each get 40 points. If it's 10,000 or fewer, they would get 30 points. And then you mix all that together, you get the average, and you get up to 40 points for that category. The next thing they look at is economic need. And we go into all kinds of details about how you can look at that. Excuse me. Also, the special consideration points. You can get extra points, and each year they change the type of extra points you can get. Sometimes it's tribal, sometimes it's one of these others that I've listed. Farm worker, distressed energy. It could be, we're not sure what it's going to be this year, but we'll know pretty soon. The next most important, or probably the most important, it goes back to those 5 W's I talked about. That's the subjective criteria, which is about your need for the services. That's why you need this grant. Who are you serving and what do they need? What are they short of? Is it a professional shortage area? Do they just simply not have access to certain types of doctors or providers and services? All of that's really important, and that can be what makes or breaks your grant, is the subjective score. So here I'm showing you just a map that indicates some of these special point areas, whether it's the distressed energy or tribal, whatever it is, we can help you locate what those are. You may not know. You may have a site or a partner who has a physical address in one of these areas, and it'll give you extra points. But we can help examine that and give you some preliminary scores when we do a free consultation with you. Okay, so we've kind of referenced some timelines already, but let's go over this again. The first thing that you really have to do, if you haven't already, is think through the goals and objectives you have for your telemedicine, telehealth program. If you've got those and you know what physical street addresses and partners would be involved, and remember I talked about confirming your logins are active, you're going to do that as soon as we disconnect from this session. And then you've got to figure out who's going to write the content of your grant, particularly those subjective sections that talks about your need. You need someone who's got the ability to write in a way that's going to make the reviewers cry. And I'm kind of kidding, and I'm not. We want them to really care about your project. That's how you get it funded. Next, you really start to flesh out that budget. And that's where Paul comes in and Amy comes in and really talks about what are all of the components that you need to spend money on outside of salaries, because that's not covered in this grant, but for the equipment and the technology and the maintenance and the 3 years of support and training for that program, because you inevitably have turnover in the remote locations. So thinking through all of those costs and getting that into a budget in the format that's going to end up in the grant is really important. And you want to be prepared to do that budget about 1 month before the due date. So at this point, we're about 2.5 months, really even a little bit more than that, almost 3 months away from the deadline or the projected deadline. So you're in a good spot for us to start here. The next thing that they're going to have you do is contact the regional representative at the USDA, and you're going to review your application needs and your content, and they'll give you pointers. They're there to help you. And then you hit the deadline. You submit the application online. You don't want to wait until the last minute. You have to check every page to make sure signatures are there. I have a whole list of other top mistakes that people make when submitting this grant, so we can help you through that. And then 3 to 6 months goes by while the reviewers take a look at all of these applications and pick the winners. Then they announce those winners. So it's probably going to be like October, November timeline. And then you go through a competitive bidding process, or you use your own internal process to select a vendor to purchase, and then you start your project. So this is a very simplified look at the process. And then we also have attached the application checklist. So early, I believe it was the 3rd slide, I talked about the sections or the steps, the components of the grant. This is a sample. This is for this particular grant, but it's 3 slides. I've got 3 slides here that cover the different sections. There's a lot of content and detail, but just realize that we help you with every single step. We tell you where to look, what needs to be covered, make sure you don't miss certain things. We sort of become project managers and a part of your staff in a way to help you succeed in creating a successful application, because it's our goal for you to win. Okay, and I'm going to cover this. Yeah.
I was going to say, do you want to pause? We do have quite a few good questions, or do you want to kind of finish going through it
I think I just have these last couple of slides. I don't even have to go into detail on them, and then let's go ahead and open it up for questions.
Okay.
And if I need to, I can go over this post-award process as well. It's a little detailed, but let's go ahead and open it up for questions.
Okay, great. Some really good questions. So if you are applying for other non-related USDA funding, does that affect your eligibility?
Well, you do want to look at every funding source. They all have their own personalities. So depending on the funding source you're looking at, you're going to need to look very specifically at the eligibility. If you're a nonprofit, if you're a healthcare organization that's a for-profit, you're usually eligible for all of those funding sources I mentioned earlier. But eligibility details will be listed in every funding source. And if you can't find that, let us know. We can help you find it.
Okay, great. And if you want to, Kristen, switch to the slide with all of our contact information as well, in case anyone wants to note it down while we're going through these questions, because you can certainly reach out to any of us with your questions after the webinar. So another question is, can the federal funding sources pay for equipment at existing telehealth access points or sites, as in pick up the next 3 years of costs, or does it have to be a new location?
Oh, that's a really good question, because it covers a couple of different topics. The locations can exist and can already be participating in any number of other programs. So the locations themselves aren't necessarily relevant as long as the equipment and the technology that you want to purchase in this grant or in this budget is going to be new, non-depreciating equipment. And when I mention that, in other words, they don't want to cover costs that have already been spent. The other interesting fact is for this grant, the USDA grant, you can begin your purchases the day after the application is due. So let's just hypothetically say March 15th, I'm sorry, May 15th is the deadline. May 16th, you can begin purchases, whether you know that you're going to get awarded or not. Maybe you already have to. Maybe that's a part of your plan and you already have to buy computers and telemedicine carts and software to manage the consultation. Maybe that's already something you've got to do and you're not sure if you're going to win the grant or not. So you take that risk, but as long as it's purchased the day after the application is submitted, it can be in your budget and it can be considered for the grant in this case.
Okay.
Yeah, so let me help clarify that. So when you create a budget, it's very specific on what you plan on buying. So obviously, since we have AMD on the call, I'll just say you have an AMD cart on that budget. And you already have some general funds and you know you need some carts. So the day after this window closes, you buy some carts. Now, you're obviously liable as an organization to pay for that out of your general funds. But if you win the grant, now you get to take those invoices and submit it to the USDA because that line item is on that grant budget. And they will cut you that check for, 85 cents on the dollar to pay for it. So obviously, we don't recommend anyone who doesn't have the money to purchase equipment. But as Kristen said, if you already needed it and you put it in your budget, it's possible that you're going to win the award and be able to fund it through the USDA rather than your general funds.
Yeah, and something else you helped me think of there, Paul, is that when you think about, let's say, May 15th, my hypothetical deadline, you submit this application, you've got this project identified, you've got your sites identified. Between that point and the time that you actually get the funds and can begin to draw down the grant after being awarded, that can take a good number of months. I told you October, November, December, that's the timeline that they typically start to announce awards. And then you have to sign an agreement and there's things that you have to do to complete this contract with the government. Well, you may have had some sites close or move or change. That's okay. You may have even had newer technology show up from AMD and you need to put in new part numbers or new technology. That's okay as well. They understand that changes happen from the time you've submitted the budget to the time that you finally get to draw down those dollars. But we can guide you as to what changes they'll be able to approve easily or what's going to require some more justification to get that approved.
Great. Another great question is if physician services are covered under the grant.
In this grant that we've spent so much time on, the USDA grant, no, the physician services and any kind of salaries, none of that's covered. And of course, we could spend hold another webinar or two on reimbursement and licensing and all of those types of things. But for that particular grant, no, it doesn't cover any salaries. It's strictly a capital grant. But there certainly are other programs that we're familiar with. It might be a combination of capital funds as well as operational costs, such as physician services or fees. So we would just have to explore those with you based on your needs.
Great. There was one question that came in and I think you addressed it, but I just want to make sure everybody's aware is where the question on where to go to get those login credentials. Is it just the sam.gov and grants.gov websites, or is there a special place on those sites so we can guide people to before we leave this webinar?
So yes, SAM.gov and grants.gov, you would want to go there, but I would say check internally first to see if your organization has ever applied for any federal grants of any type, and do your investigation internally, see who knows who submits those applications and who updates the login information. At the same time, you should be asking and checking on authority to apply or pursue other grants, because sometimes you have to go to the board to gain approval to pursue a particular grant or submit an application. So all of those things would be useful. So I would check internally first. And then you can go to grants.gov and sam.gov to see if you have a login and see how to register. And we can help you on the side understand how to navigate that process. That's unfortunately, it's the government. It's kind of complicated and takes a while, but it isn't too much of a burden on your part once you figure out either has somebody already done it, or do we just need to start a new registration? And then they also have a couple of, at both locations, the grants.gov and sam.gov, they have a technical help desk. So they have a toll-free number you can call, which sometimes is just easier to talk to a live person to get them to sort through the data to see if your organization has ever been listed. The other thing that just popped into my head too is checking the current active status. It has to be renewed every year. So even if you find out that somebody has registered and that you've got logins, you want to double check too that it's active and it's been renewed. Okay.
Great. Okay, I think that's it for questions, unless you have anything else to add, Amy or Paul or Kristen.
I see this other question here about how solutions is paid. I do want to kind of address that, because we do offer this service free of charge. This grant advocacy is what we refer to it. And I see the other question, Tracy, we'll get to that. What we do is we try to build a relationship with you. We learn very quickly if we have what it is that you might need to help support your project. But our goal is to build a relationship with you, help you apply successfully and win, and then be as competitive as possible in helping to quote and price some of these technologies. That's really why we do it. But we know that we have to put in a good faith effort to help you pursue these funds, win them, and then be a part of your pool of competitors when it comes down to implementing your project. And we work hard to prove that we know what we're doing from the beginning to cradle to grave, as they say, through the application to the implementation and the support of your ongoing project. Most customers that we've helped tend to go back time and time again, which kind of leads me to the question Tracy's asking, which is there a length of time to reapply if you've been awarded in the past? You can reapply year after year after year. I've known many organizations to go after and receive this grant repeatedly, as long as it's a new project, a new purpose, an expansion, if you will, because they aren't going to re-award monies for something they've already paid for, if that makes sense. They don't want to supplant or help you pay for something another funding source is paid for. So as long as you have expansion or new services. Go ahead, Paul.
The good news is once you've won it, you've proven that your rurality score and your economic needs score is in the right place. So typically someone who wins and gets awarded this grant can apply year after year and win. The only part, of course, the caveat is what Kristen was saying. You have to have like new goals for the next year. New services as an example. So like
maybe
I said,
new sites.
New sites. So 1 year might be behavioral health. The next year might be physical, and then there might be new partners. So you can keep applying and winning. It's really a great grant. Like I said, once you win it once, you can keep winning it as long as you have new goals to address through this funding.
I'll add that the era of COVID and going through all of that created a lot of new pockets of funding. And that has been useful and important, but a lot of that is going away. And what has remained consistent is this USDA program. There's also several from HRSA and the FCC that are consistent and have been around year after year. There's some funding sources that come and go, but the ones that have remained and have some staying power are really good ones to look at, because obviously they continue to be successful and their goals are the same as yours. They want to improve access to rural communities or to even urban communities, depending on the grant.
Great. And there's one more question here, Kristen. It says, how can we pay our consultants who are teaming with us utilizing these grants?
Okay, so that's an interesting question. I'm going to interpret it. If you say consultants that are teaming with you, I'm not exactly sure about what the consultants do. If you're talking about grant writers as the consultant, that's a cost that cannot be built into most grants. Sometimes it can be. Another category is indirect costs, which are not allowable in this USDA RUST-ELT grant, but are allowable in others. So you may have an indirect cost rate that has been negotiated and would help cover overhead and additional costs to submit an application. Those are nice. Those are really nice. And sometimes those are the grants that have no match. So we would just have to help you navigate. If there's another type of consultant, you'll have to type that into me so I can clarify, but I hope that helps. Salaries
is what they just, yeah.
Oh, salaries for, like, say, providers, that sort of thing. Again, that would depend on the grant. And again, like I said, grants and funding sources are like individual people. They all have their own personality. But there are many that will cover salaries and operational costs. So we would just have to dig in and look through that big giant hay pile and find that needle that you need to help pay for those operational costs.
Right. There's actually Brian on here from Solutions did share that there's a group in Louisiana that has applied and won 4 years in a row. And they add 15 to 20 rural schools for school-based health every cycle. So that attests to that example that you just mentioned of just continuously applying and expanding your program year after year.
Yeah, and school-based health has been a very popular application and has been growing in the past 5 to 10 years, particularly even in the last 5 years. And when you think about it, it makes complete sense. You know, having services in place where you're at so that students don't have to leave if they're dealing with chronic health issues like asthma, or maybe it's an urgent care issue, or behavioral health, and then you start to add primary care onto it over time. Most schools need to have some sort of healthcare support, but they don't always have, and most rural locations never have providers or on-site nurses or staff that can help with that. So being able to do school-based health remotely has been a huge boon for those locations. And there was one other thing I was going to talk about regarding school-based health. Oh, the parents, they don't have to leave their jobs to come get the kid out of school, or the student doesn't have to leave and miss class, and all of those types of things that really help and have increased use. And by the way, reimbursement has been improving in all of those places as well, CMS and all of the different private and public private payers and various insurance organizations, and the different payers are adopting this all the time. We know COVID had a huge impact on the CMS and reimbursement for telemedicine. And I think all of us in the industry are praying and hoping that they continue all of those relaxations in the policies around telemedicine, because it works. It makes sense. It's needed, and being able to get something in place. In workplace telemedicine programs are on the rise as well, because how easy is it if you're in the office that you can go down to whatever office and have a consultation if you need to without having to leave the building. So those are my 2 cents.
Great. Well, it looks like the questions have slowed down or ended, which is good. Just reading up, there is a couple more. Anyways, we will follow up with there's some just more comments about the program. So we'll follow up with an email with a recording of this webinar for all the attendees. And of course, you can share it with your colleagues. And if you have any questions, so for all of our contact information will be there as well. Thank you, Kristen, Paul, and Amy for joining us today on this webinar. And I hope everyone has a wonderful afternoon. Thank you.
Thank you.
Everyone.
Thanks for hosting.
Thanks.
Bye-bye.